Hi everyone, my name is Alexandra Rodriguez and I'm going to be presenting to you today the study of the effects of combined sodium bicarbonate and caffeine supplementation on repeated cycling sprint performance. So just to start off, I'm going to give you a little overview of what sprinting is, what type of metabolism it uses, how it can contribute to muscular fatigue, and then some supplements we can use in order to help prevent that. So just to start off, basically sprinting is whether you're running, cycling, swimming, anything like that, is basically covering a very short distance at maximal speed. So when you're going to be doing something like a sprint, you're going to be relying primarily on anaerobic energy sources. So we have our ATP PCR system, which kicks in the first couple seconds of exercise, followed by our anaerobic glycolysis, which lasts a little bit longer. And then, of course, we always have some percentage of aerobic metabolism being used, but it's mainly anaerobic sources in something like sprints. So in terms of repeated sprinting, where you have to do sprint after sprint in a short period of time, that's something commonly experienced during team sports. Okay, so you have to sprint, then you stop for a little bit, and then you keep sprinting over and over again. So when you're doing something like repeated sprints, you tend to accumulate hydrogen. When you use your anaerobic energy sources, you accumulate hydrogen, and that can actually lead to muscular fatigue and therefore reduce your performance. So anaerobic metabolism, like I had just previously said, it produces excess hydrogens, and these excess hydrogens lower the pH inside the muscle and can actually decrease force output by inhibiting key glycolytic enzymes. So you have your phosphofructokinase, phosphorylase, which help you produce force, as well as interfere with cross-bridge cycling, which directly leads to a decrease in force production. But if you have a method to buffer the accumulation of hydrogen, then you can therefore attenuate this decrease in muscular force output. So we have our normal bicarbonate buffering system, but if you supplement with something like sodium bicarbonate, that actually enhances your buffering capacity. Therefore, using sodium bicarbonate for something like repeated sprints can essentially help you maintain your force output and performance during repeated sprints. So when we look at sodium bicarbonate as an ergogenic aid, the way it works is it literally just raises your own levels of your existing bicarbonate levels. Okay, so this is going to be in your blood, not within the muscle. So by doing this, you create an alkalytic environment extracellularly, so it's working as an extracellular buffer, and it helps the hydrogen move down its concentration gradient from the high hydrogen concentration inside the muscle down its concentration gradient into the extracellular environment, therefore maintaining your muscular pH and being able to avoid all of those decreases in force output that we just previously mentioned. So like we just said, also this would be beneficial for something like anaerobic activity where you actually are limited by your accumulation of hydrogen and you're limiting your force output. So within the literature, it's very well documented that using sodium bicarbonate for repeated sprints works. So this is just a quick review by Matson and Tran. Okay, so using sodium bicarbonate has actually been studied for a very long time. So it's very documented. We know it works for repeated sprints. So you can see here, there's a lot of evidence to actually support that you can increase your speed, increase the time till fatigue, so you can work longer. You have a greater total work output overall during whether it's a single sprint or repeated sprints, and you also have a higher peak power output, so you can generate a higher amount of power at any given time as well. In studies that actually looked at repeated sprints specifically, it also showed that sodium bicarbonate is effective in maintaining that peak power output in the latter sprints. So of course we would assume that the first few sprints will have the higher power output and then it would slowly decline. But if we use sodium bicarbonate, we can maintain that power output throughout the later sprints as well. On the other hand, we're also going to be looking at caffeine. So in the literature, caffeine is supported for use as an ergogenic aid. It specifically has the ability to increase lipolysis and spare glycogen. However, this is more beneficial for aerobic performance. So this is pretty much just kind of a review of caffeine in general. It's also an adenosine antagonist. So adenosine is an inhibitory neurotransmitter. So it essentially blocks the binding of adenosine, thereby helping maintaining those excitatory transmission instead. It's also been shown to increase intracellular calcium concentrations, which can help maintain force output on muscular contraction as well. And it also may have some psychological benefits, such as improved mood, reduce RPE, which could definitely help during sport, and also act as a mild analgesic, so it can reduce pain and help you maintain, your movements when you might start to get sore a little bit, but caffeine can potentially help that as well. In terms of anaerobic performance, there is evidence that it helps, but it's very, it's way less conclusive. It's not as clear, but it has been shown for things like, resistance training, other anaerobic performances like sprints as well. So for repeated sprints, like I said, it's a little bit conflicting and inconclusive. So this is basically a review as well. So it shows that, yes, caffeine can help performance. It can increase your sprint power in terms of sport performance. It can help your passing performance, things like that. However, a lot of the studies when it comes to caffeine show conflicting results, such as it only showed results in trained individuals versus untrained individuals. Some studies actually showed there were no benefit. Some studies actually showed that it decreased performance as well. So, if caffeine is inconclusive, we're not sure if it works, it might decrease performance, why do I even want to look at it as a potential ergogenic aid for something like repeated sprints? Well, basically, both sodium bicarbonate and caffeine are completely cheap. They're ready available. You can go buy them in the store. You can take them acutely, meaning right before exercise or an hour or so before exercise. You don't need a loading period where you need to be taking it for a couple weeks or days or whatever. Typically, they're safe. And most of the time, both caffeine and sodium bicarbonate are allowed in sport. So hey, if there might be some potential for them both to work, then why not see if it actually works and that we can use them? So basically, we want to see if we can provide an additive benefit. So yes, sodium bicarbonate works, but can the addition of caffeine provide any additional benefit as well? Specifically, does it also maybe provide a psychological benefit? Because, it might reduce RPE, it may be potential analgesic, and all of these things could give you that little bit of edge you need during something like sport performance. So the literature in terms of both sodium bicarbonate and caffeine in specifically repeated sprints is extremely limited. I think I only found one study that specifically looked at the two in repeated sprints, and this was from Pushino, Ross, Gregory, and Savage in 2008, and it actually showed that caffeine taken alone negatively affected performance during two 200-meter swimming sprints. However, when it was taken with caffeine, it actually reversed that, and they did better. The other study by Kilding, Overton, and Gleave in 2012, it wasn't specifically sprinting, it was a 3-kilometer cycling trial, which is still pretty high intense. I included that one because it's specific to cycling and that's what we're going to be using in this study. And it showed that yes, the combined supplementation of the two did increase the mean power output and decrease their performance times, meaning they did it faster during that time trial. So there's an extreme lack of evidence when it comes to this, which is another reason that I want to further investigate the combined effect of caffeine and sodium bicarbonate. Also, most of the literature, if it did look at it, it was very specific to either one particular sport, like swimming, something like that, whereas a protocol that we're going to be using, which I'll mention in a moment, is more applicable to something like sport performance, which is what you will be probably using these two supplements to enhance anyways. Therefore, the purpose of the study is to examine the combined effects of taking sodium bicarbonate and caffeine during a repeated cycling sprint performance in physically active males. Okay, so this specific cycling protocol that we're going to be using has been validated to predict the repeated sprint ability during actual sport performance. So that's what we're using this protocol for. So just a little bit of an overview. We're going to do a study. It should be a minimum of 5 weeks because there's going to be 5 visits total with a minimum of 1 week apart. We're going to be using physically active college-aged males. Some of the measurements we're going to look at are peak power output in watts, mean power output also in watts, total work over the entire protocol measured in kilojoules, and we're also going to be looking at rating of perceived exertion, which may show us a little bit of that psychological component. So there's going to be 4 supplement combinations, so we'll have a combined group, which is sodium bicarbonate and caffeine, sodium bicarbonate only, caffeine only, as well as a placebo. So the hypotheses are that the combined group of sodium bicarbonate and caffeine will have higher measures in peak power output, mean power output, and total work output during all of the repeated cycling sprints when we compare them to all the other groups. Additionally, we hypothesized that the sodium bicarbonate only group is going to perform better than the caffeine only group and the placebo, but not as well as the combined group. Also, we predict that the combined group, so sodium bicarbonate and caffeine, will have lower RPE values when compared to both the sodium bicarbonate only and the placebo group. And also the caffeine group will perform better as well. So basically, in our participants, we are going to recruit 20 college-aged males. So they're going to be between the ages of 18 and 27, so graduate school maybe as well. They need to be physically active, meaning they need to participate in at least 150 minutes per week of moderate to vigorous intensity physical activity. They need to be not consuming any more than about 1 to 2 caffeinated beverages per day within the past 6 months, so we don't want them to have a previous tolerance to caffeine. They also can't be using any performance-enhancing supplements or medications or anything like that, so no beta-alanine, no creatine. We don't want them on some sort of metabolic medication that can affect things like that. And they also need to be in good health, so no cardiovascular or orthopedic issues. They can't have any recent injuries either. And lastly, they cannot be an elite athlete, which is a little bit vague, but we don't want somebody having, a severe performance advantage over other people as well. Some limitations for the study. Basically, the inclusion and exclusion criteria itself is, so for example, we say 150 minutes of moderate to vigorous physical activity per week, but some people might overestimate that, some people might underestimate it. They may not really get what moderate to vigorous intensity means, but we're going to do our best to explain it, and basically, it's still a limitation, as well as the definition of an elite athlete. So what does that really mean? We just don't want people to be, an elite cyclist or someone on a sports team. But again, we're not sitting here doing a VO2 max test on them or anything like that, so there is the possibility that some people may be more trained than others. A little bit more specifically, some people might not have cycling performance. So because there are going to be at least 4 exercise sessions, there might be a little bit of a training effect where the first session they don't perform as good as the last session because they kind of get used to it when they didn't know how to do it at all to begin with. Also, RPE is completely subjective in nature, especially with people who aren't used to using RPE. There's a chance that they don't really know how to report it accurately and how to use it correctly. And also, even though we're giving a caffeine limitation for the study, some people might have a little bit of a tolerance versus others, thereby kind of limiting the treatment effect when they actually take the caffeine. Also, some people, the literature shows that some people respond more to caffeine than others. There's different genetic components behind that. Some people, they can, drink a lot of coffee or take a lot of caffeine and it does not affect them, while some other people feel like they're going to have an anxiety attack from 1 cup of coffee. Me personally, I cannot drink caffeine, so I would think I am a little bit more of the responder on that side, but that could potentially affect the results of the study as well. So the study design is going to be a randomized blind crossover design. So they're going to receive 1 of 4 combinations on each of the 4 exercise days. So we're going to have a combined group where they have sodium bicarbonate and caffeine. So for every single day that they come in, they're going to be taking 2 capsules total. So for the combined group, it's going to be 1 capsule with 6 milligrams per kilogram of body weight of caffeine. And then the other capsule is going to contain 3 milligrams per kilogram of body weight of sodium bicarbonate. On the sodium bicarbonate only day, they're going to have 2 capsules with a total of 3 milligrams per kilogram body weight of sodium bicarbonate. The caffeine only day is going to be the same thing, 2 capsules with a total volume of 6 milligrams per kilograms of body weight of caffeine. And then the placebo group is going to have 2 capsules with a total of 1 gram of maltodextrin. Just as a placebo, it has no performance effects. All of these combinations will be ingested 90 minutes prior to the exercise, and they're going to take it with 450 milligrams of 450 milliliters of distilled water. So like I said, there's going to be 5 visits total. The very first visit is essentially just a familiarization day. They're going to be going over the informed consent, the health history questionnaire, and the physical activity questionnaire, which will help us determine those exclusion and inclusion criterias. We're also going to be taking their anthropometric measurements. Specifically, we need to look at their weight in kilograms so we can determine the proper dosing amounts for the exercise days. And then they're going to complete a familiarization protocol, which will help them get used to the cycle ergometer, help them learn what we're looking for in a sprint, and pretty much will also determine where their saddle adjustment needs to be and their handlebars and things like that. So the familiarization protocol specifically is just going to be 5 minutes of cycling at 50 RPMs. Then we're going to do 2 6-second all-out sprints, which will be what the type of sprints they're going to experience on the exercise days. Each sprint is going to have 30 seconds of rest between each bout, and then they're just going to have a cool down for about 5 minutes at whatever RPM they choose. On the exercise days, we want them to arrive between 8 a.m. and 12 p.m., so in the morning. And they need to have eaten their last meal at least 3 hours before they come in. Okay, so we don't want food in their stomach. We want to make sure, because we are doing a supplementation study, they can't really eat right before they take the supplements. On the very first day that they come in, we're going to ask them to complete a 24-hour dietary recall and then ask them to mimic the same exact diet for the entire 24 hours prior to exercise for the remaining 3 exercise days as well. We also don't want them to have any caffeine at least 48 hours before each exercise day. And then lastly, we will just take their heart rate and blood pressure before and after exercise, even though we're not using them for the study specifically, just to get some extra measurements in there. Each visit will also be separated by 7 days at least. And when they come in, the supplement combination will be completely randomly assigned. So some people may have the sodium bicarbonate on the first day, some people might have caffeine only on the first day, and it will just be randomly assigned for all 4 days. The protocol itself that they're going to be going through on each exercise day is a repeated sprint ability protocol. It's previously published. Like I said before, it essentially will carry over to sport performance. So your performance during this protocol can predict your performance during sport as well. It's going to be done on an SRM cycle ergometer, which specifically can measure your peak power output, your mean hour power output within the cycle ergometer automatically, which is really nice. So when they do this, they're going to be starting in a standing position, meaning they're standing on the pedals, one pedal's all the way down and one pedal's all the way up. That way, it's kind of standardized for each person. Again, it's only 6-second sprints. We don't want people trying to fumble around and get up to speed when they only have 6 seconds to do the entire sprint itself. We're going to adjust the saddle to allow for 10 degrees of knee flexion when their leg is maximally extended. And then right before each sprint, so there's a total of 5 sprints, we're going to give them a 5-second verbal countdown. That way they're ready to go as soon as the timer starts. So here's the protocol. Basically, it's going to start with a warm-up of 5 minutes at about 50 RPMs. And then they're going to go through a series of 5 sprints of 6 seconds each, pedal as fast as possible, and then they're going to rest for 30 seconds with no pedaling. Following the 5th sprint, they're going to complete a 5-minute cool down, pedaling at any RPM that they choose. So some of the things we're going to record are going to be peak power in watts. We're going to record that for every single sprint. It's going to be recorded again through the cycle ergometer automatically. So every single sprint will get that peak power output. Again, we anticipate that the first few sprints are probably going to have the highest peak power output, followed by a slow decline as well. We will record mean power output during every sprint, so just overall the average power output per sprint. And then the total work will be calculated following the completion of the 6th sprint. And this is going to be in kilojoules, which is watts per times seconds. So how many watts did they put out through the entire 6-second sprint versus the seconds, and then divided by 1,000, and then we get that in kilojoules. We're also going to be recording RPE using the Borg 6 through 20 scale. We're going to take this after each individual sprint, as well as after the session overall. So how did the entire sprint protocol feel as well? The statistical analyses we're going to be using will be all completed on SPSS software version 25. So in order to look at the within subjects effects for all values, so peak power, mean power, total work, and RPE, we're going to use a repeated measures ANOVA. So if we do determine that there is any significant differences in terms of those measures, we'll use the appropriate post hoc test in order to figure out where those differences are. And of course, all of the significance are going to be set at equal to or less than p equals 0.05. So that's it. I hope you enjoyed my presentation. I look forward to hopefully completing this study in the future. If there's any questions, please let me know.